update on our COVID vaccine rollout. Dr. Tamara Sheffield, Medical Director for Intermountain Healthcare Community Health and Prevention, will be giving that vaccine update. Then we'll have two of our nurses that received that first vaccine. Monty Roberts, who's an ICU nurse at LDS Hospital, is here in studio, and Sophie Woodbury, a surgical nurse from LDS Hospital, is actually at the hospital today and will be joining us as well via Zoom. So we'll get started. Just a couple housekeeping notes. We are recording and we'll provide the link afterwards like we generally do. We also have B-roll of several caregivers receiving the second dose, including Monty and Sophie, which we'll be providing following. If you have questions, please put them in the chat along with your name and organization, and if the question is directed to anyone in particular. So thank you. Dr. Sheffield.
Good morning, everyone. I'm Dr. Tamara Sheffield. I'm the Medical Director for Community Health and Prevention at Intermountain Healthcare. And we're here today, actually 3 weeks after we were with you, back on the 15th of December, is when our employees and caregivers received their first dose of the COVID-19 vaccine. We've been, in that interim time, vaccinating individuals both with the Pfizer and the Moderna vaccine. Depending on the freezer space that we have within our facilities, it's determined which vaccine we're giving at those. And now we're celebrating another milestone where yesterday we had caregivers 3 weeks from the time they got their first dose receiving their second dose of Pfizer vaccine. Now the Moderna vaccine is a 4-week separation between doses, so we have not begun that process yet, but we will be now scheduling and having our employees receiving their second dose. We spent the first couple of weeks working on making sure that those who have the highest risk contacts, those who are working on those units, work with our COVID patients, had their vaccine, and then after those couple of weeks we were able to open up the vaccine more broadly to other employees within the organization. It's important, and we need to really stress the importance for the population that they get both doses of the vaccine that they're given for their first dose. The effectiveness of the vaccine really changes depending on getting the second dose. The data we have from Pfizer, we don't have a lot of information about the effectiveness of the first dose because there's really only a 21-day window when they could see the impact of that, and there was some protection. But what it really did was it only reduced the risk by half. So if 100 people in the placebo group got did not get a vaccine and became infected, those who did get the vaccine, only 50 people of that would have become infected. But with the great effectiveness we have with these mRNA vaccines of 95%, that is a tenfold difference in terms of its impact. For every 100 people who don't get the vaccine that become ill, if you get the vaccine, only 5 people. So rather than 50 people, 5 people, you're looking at a 10-time difference in making sure that you are protected when you get that second dose. So we're making sure that all of our healthcare providers are getting their second dose, and as we start rolling out the next phases of the community, we're going to be stressing the importance of appropriately getting that second dose.
Excellent. Thank you, Dr. Sheffield. Now we'll have Monty go ahead and give a few comments on his experience with the second dose.
Hi, my name is Monty Roberts, and I work at LDS Hospital, and I am thrilled to be here today. I received my second dose yesterday at about 10:30 in the morning, and so it's roughly been 24 hours since I've had my dose, and I'm tired. I haven't had any side effects that have been significant other than a little bit of a sore arm like I had the last time, and being tired. And so I'm really excited that I've had the opportunity to get both doses. And I think that, just as Dr. Sheffield said, that's the importance, is to get that second dose and to complete the point of getting the vaccine is to get both doses.
Excellent. Thanks, Monty. Now we'll have Sophie Woodbury from LDS Hospital join.
Hi, this is Sophie Woodbury. I'm a nurse at Lds Hospital on the surgical floor. I just like Monty, I got my second dose yesterday morning. After my first dose, I had 0 side effects, which was great. This morning, I woke up with a little bit of a headache. I took a couple ibuprofen, and that really did the trick. So overall, I would say pretty mild side effects and nothing that I'm really concerned about. I'm really grateful I could get that second dose. I know my body is producing spike proteins, producing antibodies. And so with the second dose and a few days down the road, I feel a little bit more relief. I feel more protected, and I feel more encouraged for the future.
Excellent. Thank you. All right, now we'll go ahead and open up for questions. We've already got one from Sean Means. This is kind of a follow-up. Some of this I think you've already covered, Dr. Sheffield. Utah Department of Health told us on December 30 that Intermountain was close to being done with distributing their first batch of vaccine. Are you done with that batch? How many doses were in that first batch? And did they all go to frontline care workers? Have you ordered more? There's a bunch of questions.
Yes, okay.
Maybe I
So
should stop there for now.
I'll start addressing those. So yes, we are, but we plan that by the end of this week, we should have all of the first dose allocation distributed. We have been giving vaccine, we have 25,000 of our healthcare workers that have been vaccinated, but are also helping in a few of our local health departments with bringing in EMS, first responders, and we also have a couple of our own in-house long-term care facilities, and those patients have been vaccinated as well. So we are moving into helping the local health department in their strategy of moving to both the healthcare workers and others. And while the primary location for some of our clinic physicians that are not employed within Intermountain Healthcare has been the local health departments, we've also been inviting those individuals through the local health department to come and receive some of that other medical staff to come in and receive that vaccine here at our facility as well.
He also asks, have we ordered more vaccine, and if so, how much, and when would that be arriving?
Oh, that's a great question. So the way that the distribution channel works with the health department is when you are allocated a number of doses for your first dose, they allocate at that same time the amount for the second dose. So we do not have to order that. It automatically gets pushed over to our organization so that it's there and in place for the time when we need to give the second dose to individuals. So we have not made another order. We're working in process with the plan for the Utah Department of Health that they've had set up of how much they would give us first, and then they are also then providing us those second doses. Was there a second half to that question?
I think that's all the pieces to it. Okay. If we missed something, Sean, just go ahead and tag us again. Okay. And now Jed Bowles asking, are any people experiencing nausea after the first shot? Has anyone had to miss work after either first or second shot?
That is a great question, and what we are making sure that we do is our employee health nursing program is receiving any kind of feedback from the employees if they're having concerns. We are also signing everyone up with the V-Safe program of CDC so that CDC directly every day is getting able to survey anyone who's received a vaccine and find out how they're feeling and what symptoms they may have had and how that's impacting their work as well. So that information is flowing directly nationally so that we have a large database, not just our smaller numbers that we're doing here. In terms of people missing work, we do not allow our employees who have fevers to be working in our facilities. And it's expected that with the first dose, anywhere between 4 to 5%, that was seen in the study trials, of individuals would have fever. I don't think we've had quite that level of individuals showing fever in the first dosing. People have tended to have more mild symptoms. And so we expect, though, to see more individuals once they get their second dose have the symptoms that may keep them off work. And we're actually telling people to try and, we're staggering a bit who gets vaccine within specific departments so that we don't have places that don't have enough staff to take care of the patients there. We also are telling individuals to try and schedule their vaccine where they're off shift for that next day after the vaccine, because usually symptoms tend to be only last about 1 to 2 days at the most after vaccination. So yes, we have had individuals who've had some symptoms. Most of the symptoms we're hearing, though, is just the sore arm for this first dose.
Excellent. Now we've got a question from Rain Williams at the Daily Herald, and I'm not sure that this isn't a question better suited for the Utah Department of Health, but I'll let you decide that on Dr. Sheffield. Where is the vaccine distribution in terms of phases, and why is the state seeing vaccinations for teachers and others being pushed back? Delays in shipments? How does this impact the timeline of April for the vaccine to be given to the general public?
Great question. So yes, in terms of pretty much the specifics of the number of doses coming from CDC, when they were expected and when they're arriving, definitely the Utah Department of Health is going to have better specifics. But what we do understand, being on the front end receiving, is that the first allocations that we were given were reduced by the CDC, which has shifted our timing by a couple of weeks. So it's not necessarily shifting it dramatically, but we are going to we have received less than we thought at the very beginning. And so right now, the phase that we're in is still healthcare workers, long-term care facility residents, and those, I believe, are ramping up. And we've had many taken care of now, but those are ramping up in the next week or two as well. And then EMS and first responders are currently in the process at local health departments and in some of our facilities being taken care of as well. So that's the first group. As the next allocations of vaccine come in, that is supposed to come for the K through 12 educators. And as I understand, that did get shifted by 1 to 2 weeks in terms of when they would begin doing that. And that is specifically happening through the local health department. So you can either reach out to your local health department or to the state health department for more specifics in that. And then we expect that they will then roll through various stages. The next one would be those who are 75 and above. And then we will be moving through different ages and risk factors that have not yet been determined prior to it being open to the general public. So we don't expect long delays as long as expected shipments keep happening.
Excellent. One more question, then we'll go to our caregivers. Wendy Leonard from the Deseret News. Are you experiencing a high number of caregivers who are opting not to get the vaccine? If so, how are you adapting to that?
You know, that has been something that as we watched the surveying over the last year, how many we would expect to have come in. Our targets were pretty right on. We are not seeing a lot of individuals flat out denying and not wanting to get vaccine. That's the very small minority. We do have some individuals who, whether it's for a condition they have that may make them wait, or just their own choice, are kind of in a wait and see. And that's a larger group, but really we've had an overwhelming response of individuals that are caregivers wanting this vaccine, waiting for this vaccine, knowing how it will impact them, and are wanting it as quickly as we can possibly deliver it to them. So as we look at our vaccination estimates, most of our units and the types of job classifications, anywhere from 60 to 70%, are already vaccinated, and we will. What we were expecting as we surveyed our individuals ahead of time is really kind of what we're seeing the result of. So nothing surprising there.
Excellent. Okay, now we've got a couple questions for the nurses. So we'll start with Sophie and then we'll come back to Monty. Chris Reed from the St. George News asks, for those who have had the second shot, what would you say to those who fear the side effects?
Yeah, that's a great question. So I had slightly more side effects on that second shot than the first one. I would say if you're nervous about side effects, just talk to people who have gotten the shot. get some of that anecdotal experience so you can feel comfortable about listening to others, seeing how it made them feel, and hopefully that can build some personal confidence in getting a shot and being vaccinated. And then I would also just add, as far as the numbers of caregivers that are getting vaccinated, I can't speak from a statistical perspective, but just from an anecdotal perspective around my floor in general, people are really excited and want to get signed up for an appointment, want to get their shot, and are really feeling positive and confident about it.
Thanks, Sophie. Same question, Monty. What would you say to those who fear the side effects?
I agree with Sophie, is that do your research, ask some questions and get out there and look at what's been stated and talk to people. That's probably, besides what I do in the ICU, that's what I've done mostly on my days off, is talk to people and ask them, hey, are you going to get the shot? Have you had any side effects, and what are those side effects? And again, underwhelmingly or overwhelmingly, that it's been a positive thing. And again, those side effects have been very minimal with all of the people that I've talked to. And so, but I think the important thing is to get out there and do your research and talk to people and see what you find out, and let those people not necessarily convince you, but let you know how it works. And like we've stated before, everyone that I know and the people that I've seen on my unit have had very minimal, if any, side effects to the vaccine.
Excellent. And then we'll just go with Monty and then back to Sophie. Monty, can you explain how getting the vaccine has impacted the work you do?
Uh, Absolutely. Excellent question. I think that one of the biggest things that's impacted is we have a lot of hope. And I appreciate Sophie stating that when she received her first vaccine, is we look at the numbers, and even now we're still seeing numbers go up of people that are getting infected with COVID. And one of the biggest things is that we hope in the near future that those lines will cross, meaning as we get more vaccinations to people, that we'll actually see a decrease in the amount of COVID patients that we both are admitting to the hospital, as well as the patients that are being tested positive. And so that's a huge hope. Well, I think on the second part of that is I would really like at some point to be able to take this mask off. And I'd like to have people see the smile that I have behind this mask, because of the work that's been done by our scientists and our physicians and our nurses and all the people that have really helped in pushing this forward, and that we can actually beat this and move forward together.
Awesome, thank you. Okay, we'll bring Dr. Sheffield back up. So Kate Webb with the Herald Journal asks, can you speak to vaccinations for certain areas, such as Logan Regional Hospital, and if that's one of the areas where vaccinations are being administered to members of the community outside the hospital?
So in terms of specific areas, I do know so the facilities that have been, we've had some that have been working on the EMS and frontline responders. We have a small facility up in southern Idaho, Kaja, which from day one knew that they would not be able to cover everybody. I mean, that they had too much vaccine in the first delivery, and the state had already planned for them to give it broadly within the community to these first responders and long-term care facilities from day one. So we knew that that was going to happen. And then as we've found a few other spots, such as Park City, Cedar City, St. George, we are working with the local health department and having them direct individuals to those facilities. I know that in Logan, we have vaccinated our long-term care facility residents at the Logan Hospital. And at this point in time, I believe that we do not, I don't know what the a number of other types of individuals may or may not be at the Logan Regional Hospital. That's something that we'd have to ask their administration and the local health department.
Thanks. Jed Bull, KSL asks, is there a way to speed up the process? Why is there vaccine in freezers when it should be going in arms?
You know, that's I think the national question, local question, and all of this is really dependent on logistics and how well we can get vaccine to our locations and then get the individuals who need the vaccine to those locations. And the wonderful thing is we have been, in those first couple of weeks, as we've been watching the process, we've also been constantly learning. And we're able to, in the last week, vaccinate so many more that we are now getting the systems in place where we feel this will be moving and moving quickly. We have a large population. People, and we talked about the fact this is a marathon, not a sprint, because there are limitations in terms of the number of hours we have, the number of people we have to administer a vaccine, and the amount of vaccine that we've been given. So we will ramp up as we are given more vaccine, and we will have the capacity to keep doing it more and better as we keep learning in the process.
Dr. Sheffield, do you want to speak to social distancing when it comes to vaccination clinics?
Yes. One of the key pieces of this as well is making sure that we have a safe environment for people to receive their vaccines. And so in those facilities where we've been vaccinating, we are scheduling ahead of time. So we know the volume of individuals. We don't have a overwhelming number in line. For those who are lined up, and having gone through this, the line has moved very quickly. You have spacing, just like we do in many of our stores, places, standing spacing so that we are keeping those distances. We have our vaccination stations well separated. And then after the process, there's a wait period where we have staff watching for individuals who may have an immediate reaction. Some people who have allergies will also show allergic signs and symptoms after receiving this vaccine. And so we want to make sure we catch those individuals, give them the appropriate care and treatment. And so therefore there are, depending on your previous risk factors for allergies, there's either a 15-minute or a 30-minute wait in those stations afterwards. And we are keeping people distanced in large areas. So what we are finding, this is something we're learning, is that bigger spaces are better as we are trying to do safe, distanced vaccine delivery.
All right. And Melissa Anderson from CEC TV in Southern Utah, why the rush for vaccine distribution?
That is a great point. And really there's two factors. One is we need to move through and get vaccine to people at risk before they become infected and have the adverse problems from infection. So that's when the CDC did modeling for how vaccine would impact the health of our country and protect people. Earlier vaccine and early distribution of vaccine was a key factor for protecting the population. The second feature is we have to demonstrate our capacity to be vaccinators to the federal government. And so future deliveries of vaccine are dependent on how well we can quickly move through and provide the vaccine we've already been given. So we actually have to use up very quickly the vaccine in order to be able to say to the CDC, it's time to bring this state more. And so those are the factors that are making us want to move as expeditiously as possible.
Then I'm going to skip down to a question from Rain Williams of the Daily Herald. What are the next steps for vaccination at Intermountain? Will Intermountain hospitals act as a place to receive the vaccine after healthcare workers receive it?
Yes, the answer to that is yes, that Intermountain is going to follow the state and local health department plans as outlined to them by the CDC. And we want to be partners in this. So under their direction, we will be having our hospital facilities be in the non-patient facing areas of those facilities. We will be providing community-based vaccine when the time becomes appropriate, and we are currently working on those plans and coordinating with local health departments.
Okay. All right. And then Melissa from CEC TV again asks, are vaccines recommended for people who have immune problems like lupus?
Oh, that's a really great question. So all of this is a matter of us personally weighing out individual risk. And there are some things that we have that are unknowns as we are weighing out those decisions. So in the initial trials done on these vaccines, people who were immunocompromised, whose immune systems weren't working as well as they should, were not being tested in the trial. And so because of that, there weren't enough individuals for the CDC to be able to make a determination should or should those individuals not receive a vaccine. But there were individuals who did have immune mediated diseases, such as individuals with rheumatoid arthritis or individuals with lupus, that were included in the trials. And we have not seen in those individuals any untoward events that were happening more with them than with the general population that's received the vaccine. But we also don't know from an effectiveness standpoint and a long-term effectiveness standpoint whether any immune modulating drugs or people with immune system problems, it's most likely that they may not respond and have as much protection from a vaccine. So when we talk to them, when we talk to individuals who have those conditions, we tell them what we don't know, which is we don't have enough study data to inform them whether it is a safe and effective vaccine for them. And we don't know if their immune condition may make the vaccine not work as well for them. Those are the things that we don't know what's going to happen. But then we say, we need you to look at your life and what your risks are, where you work, who you interface with, because you're also at higher risk for, if you have the disease, of having untoward effects because your immune system doesn't work to fight the disease as well. So it's a matter of individuals having to balance out those things with as much information as we can give them, but there are many unknowns still.
Excellent. And Ryan from Daily Herald asks, what are the next steps? Oh, I'm sorry, we already asked that question. Wendy Leonard from the Deseret News asks, should the immunity only last 6 months? Are you prepared to redo this whole process? Or what is the plan should that be the case?
Wonderful question. And just from the concept standpoint, having worked with vaccines for the last 25 years, most vaccines work longer than that period of time. Okay? So when we look at immune memory, there are some vaccines which may have a really good impact for 2 to 3 years and then less. We have other vaccines that provide lifelong immunity. And so you can have a large spectrum between those. And just as we do with other diseases and conditions that we protect using immunizations, we will evaluate how long lasting the protection is with this vaccine, which we don't know yet. And at that point in time, we'll make the decision when is the appropriate time and when should we give boosters if we need to. So it's something that we don't have an answer for yet, but if, as we have with all other vaccines, if we need to provide boosters in order to protect people from vaccine preventable diseases, we will give boosters.
Excellent. And Sean Means pointed out that I skipped over Sophie when asking the question about how the vaccine is helping her to do her job.
Yeah, that's a great question. I mean, the first answer to that is my job doesn't change, whether I'm vaccinated or whether they're vaccinated. Everybody gets good healthcare no matter what. So the thing that changes for me is my state of mind and my a bit more positive perspective that I'm able to have. Because when I have really hard days, which are still frequent, I don't have to feel quite so doomed. I can feel like a little bit more that like there's relief, like coming, like there's an end to this pandemic. And I'm part of that fight for this to end because I am vaccinated and I have protection. What the vaccine does in our bodies is really amazing, and human bodies are amazing. I see that every day that I work, that people's bodies are able to recover from incredible things and heal and get better. And so I think one important thing to remember about this vaccine is what your body does when you get the vaccine is even more incredible than the science that created the vaccine. Your body is amazing, and you can take care of your body and treat it like this incredible gift that it is, and do something good for yourself by getting a vaccine and protecting yourself and helping others.
Wonderful, thank you. For Dr. Sheffield, in the past month or so, what have you and other vaccination leaders learned about the vaccine that's helpful to know?
Oh, that's a great question because this has been a learning environment and a quickly learning environment. Things that we have learned, one is communication is key, just like we're doing right here and right now, making sure that we tell the community what we know, what plans we know, and also asking them for patience when there's things that we don't know yet and plans that still have to be made. We've learned that I just partly I want to express gratitude. We have learned that we have teams that are volunteering 7 days a week to pull this together and get this out, even through the holidays. We have our employee health nurses have not had a day off and have not spent time with their families. So we have learned, again, as we keep learning, that we have dedicated and caring individuals that we get to work with. We've also learned that we have to be very flexible when we don't get the amount of vaccine at the time we expect it, or when you invite one group of individuals and may not get enough people in that group, we have to flex out to a different group of individuals to bring them in and make sure that we don't waste time and we don't waste vaccine. But one thing that we've learned is that we have good systems in place and they have been working well. And that we can have confidence in our pharmacy groups who've been supporting this. We can have confidence that the safety and appropriate processes are taking place. And we've learned that we have very good public-private partners between our healthcare systems and our local health departments. And that we have a group of individuals, it's people with goodwill trying to do good work. And I've just appreciated being part of that process.
Thank you, Dr. Sheffield. Looks like that's the last of the questions we have. I don't know if you have any last thoughts that you want to share.
Just that we want to really just, I think a lot of this is to help you understand our confidence in the idea of vaccines, what they have the potential to do in our populations, what they've done in past decades as we have had pandemics of other deadly diseases over the years. Vaccines have been a key mitigating strategy, and we are grateful for the science that has allowed us to quickly find vaccines that work for this specific virus. So the again, I guess the key messages are watch the plan, see when your appropriate group is coming up, understand that we are trying to hit individuals who have high risk and need protection as quickly as possible, and we are working with all due diligence to make sure that the vaccine gets out to our whole population as quickly as possible.
Excellent, thank you. Well, that will conclude our English press conference at this point. We have Dr. Michelle Mateo that's going to join us for Spanish speaking in just a couple of moments. If you would just like to hold on for our Spanish media. For the others, we will once again provide the link to the video recording as well as B-roll of several caregivers receiving the second dose, including Monty and Sophie, shortly after this. So hold on just a second while we reset. We'll give a brief opening, and then in this case, we'll have you unmute your mics and ask questions directly to Dr. Mateo, as I don't speak Spanish and I don't want to have to try and misinterpret your questions. Thank you.
Muy buenos días a todos. Es un gusto para mí participar en esta conferencia de prensa, una vez más, hablando sobre las vacunas contra COVID-19. Estamos muy contentos de estar en esta etapa ya, terminando la primera jornada, la primera fase, con la mayoría de nuestros trabajadores de salud vacunados con la primera dosis y ya moviéndonos a la segunda dosis, al igual que a otros miembros de la comunidad. Y con eso lo quisiera abrir a preguntas.
Ahora sí. Saludos, doctora Michelle Mateo, Rudy Nieves de Telemundo. Tengo 3 preguntas. La primera, ¿cómo va la segunda dosis de la vacuna en este proceso ahora que están recibiendo la segunda dosis? La segunda pregunta es, ¿por qué si ya hemos recibido cerca de 150,000 dosis de vacunas, solamente se han administrado cerca de 50,000? Y la tercera pregunta, si nos pudiese explicar brevemente cuál es el proceso de hacer una vacuna.
Ok. Bueno, la segunda dosis se ha comenzado a dar esta semana. Ya comenzamos esa fase y las personas que lo han recibido no han reportado mayores efectos adversos. Lo que se escucha es que es bien tolerada y simplemente se escuchan buenas cosas sobre sentirse contentos de recibir esta segunda dosis. Yo recibí mi segunda dosis el día de hoy y no he tenido ningún efecto secundario. En general, los estudios clínicos indicaban que las reacciones se iban a notar un poco más en la segunda dosis que en la primera dosis, entonces vamos a ver cómo va esto en las siguientes semanas con más personas siendo vacunadas con esta segunda dosis. Más por conocer. Con respecto a tu segunda pregunta, en cuanto a la alocación de dosis, nosotros estamos siguiendo las guías de la CDC, quien informa al Departamento de Salud en cómo debería de ser la estructura y las diferentes fases de vacunación. Y basado en esta guía es como nosotros hemos ido implementando la vacunación. Nosotros en Intermountain hemos sido alocados vacunas para los trabajadores de salud y tenemos suficientes para la primera y segunda dosis. Y más allá de eso, creo que es una buena pregunta para el Departamento de Salud contestar cómo es esta alocación de dosis para la comunidad. Y tu tercera pregunta sobre... ¿cuál fue tu tercera pregunta? Te escuchamos ahora.
Ahora sí, en la tercera pregunta lo que pasa es que hemos estado hablando con algunos televidentes y ellos tienen la duda de cómo se crea una vacuna. ¿Cuál es el
Ah,
proceso
ok.
o menos cómo se crea?
Bueno, existen diferentes tecnologías de vacunas. Hay muchos tipos. Esta tecnología y hay diferentes tecnologías siendo estudiadas para la vacuna de COVID. En particular, la vacuna de Pfizer y Moderna utilizan una tecnología un poco novedosa. Em, no quiere decir que sea completamente nueva. Es un tipo de tecnología que se ha ido estudiando a lo largo de varios años ya, pero nunca se había implementado en la práctica. Esta es la primera oportunidad que tenemos para implementarla. Em, se lleva a cabo muchos diferentes tipos de estudios con muchas rigurosidades. Entonces, por lo general, toma muchos años en llevar a cabo el desarrollo de una vacuna. Primero lo tenemos que probar que el método funciona en los laboratorios, que la idea que tenemos de la vacuna va a funcionar. Luego se estudia en modelos de animales o diferentes modelos para ver si es eficaz y segura. Y luego tienen que haber estudios de estabilidad, tiene que haber estudios en humanos saludables para ver cuál es la dosis recomendada, cuál es la dosis que se tolera, y así sucesivamente hasta que llegamos a los estudios ya más avanzados de fase 2 y 3 de eficacia y seguridad en humanos. Y todo esto se va rigiendo con las entidades gubernamentales que se aseguran que los procesos y los estudios se van llevando a cabo como deben de ser. Y es muy riguroso el proceso. En esta ocasión hemos visto que la vacuna se desarrolló impresionantemente en un corto plazo de tiempo. Esto no quiere decir que nos saltamos los pasos. Lo que se hizo fue se diseñó y se puso en práctica una estructura en donde todos los candidatos de vacunas tienen que seguir estos elementos, y se invirtió mucho recurso, muchas personas, mucho recurso, mucha energía de trabajo para enfocarnos solo en el desarrollo de esta vacuna y que se pudieran hacer todos los pasos necesarios, pero en una forma expeditada. Entonces, lo hicimos rápido, pero se cumplieron todos los pasos y todas las medidas de seguridad.
Do you have any further questions? All right, taking that as a no,